Hi, everybody. Thank you so much for coming. My name is Katie Braddock. I am a veterinarian and a part owner at Plum Creek Veterinary Services in Castle Rock. And today we're going to talk about various types of cancer in dogs and cats. You're good to switch. There we go. So I threw this in here. Definition of companion animal is a domesticated or domestic bred animal whose physical, emotional, behavioral, and social needs can be readily met as companions in the home or in close daily relationships with humans. So it doesn't really necessarily just mean dogs and cats, although that's what we're going to focus on today. It can also include horses, rabbits, ferrets, guinea pigs, mice, rats, etc. There's a lot of different companion animals. It's thinking. So we'll start with kind of the top 3 cancers in dogs, and this is in my personal experience. I think it probably varies depending on your clientele and what kind of animals you see. But for me, the top ones are lymphoma, osteosarcoma or bone cancer, and hemangiosarcoma or a cancer of the blood, basically. So we'll start with lymphoma. It is primarily characterized by enlargement of all of the peripheral lymph nodes. It's called multicentric lymphoma. It can also be in other places, such as the intestines or the GI tract and the liver and the spleen. It's probably less common, more common to see the peripheral lymph nodes. They have quite a few of them, some kind of underneath the chin, in front of the shoulders, behind the knees. There's also in the inguinal region, and then there's some internally as well. By and large, most dogs that have lymphoma actually feel pretty good, and most people would not know that anything is wrong. It's often picked up on a routine physical exam. For diagnosis of lymphoma, the most common way to diagnose is by aspiration or using a little needle to take a small sample of the lymph nodes. And then we would send that out. You can either stain it in-house and look at it yourself, or what we typically do is actually send it out to our lab and have the pathologist confirm the diagnosis. The GI tract, we may do an ultrasound. Typically you'll see thickening of the walls of the intestines or potentially the walls of the stomach. You can also see enlargement of the lymph nodes that are within the abdomen, which are not really things you would be able to see or feel on the outside of the dog. We would also could biopsy those areas or aspirate those areas with an ultrasound guiding it in there. Spleen and liver, also again, ultrasound and aspiration, typical way of diagnosing that. There is another thing called flow cytometry that's becoming more popular to do. It determines T cell versus B cell lymphoma. The reason that's important is it can provide prognostic information. Typically, B cell is easier and responds better to treatment. T cell is a little more difficult to control. Staging is pretty important in lymphoma. Stage 1 is just a single lymph node or site involved with no evidence of metastasis or spread to any other organs or any other areas. Stage 2 is 2 or more lymph node regions on the same side of the diaphragm, so basically either up above here within the head or in the shoulders, or down below in the back of them. Stage 3 is 2 or more lymph nodes involved, but it crosses the diaphragm, so you could have involvement of the submandibular lymph nodes, the ones under the chin, and the popliteal lymph nodes are the ones behind the knees. Stage 4 is lymph nodes plus liver or spleen, and stage 5 is extranodal tissue. It can affect the bone marrow and a lot of other areas. It's not very common. Unfortunately, by the time we diagnose it, most dogs are in stage 3 or higher. Go ahead.
So you said that usually they're feeling pretty good and you would find it just on one of their routine exams. Mm-hmm. So would that be like if it was in the lymph nodes, would you like notice like swollen lymph nodes or something?
Some people do, yes, just depending on how big they are. A lot of owners, I see dogs that come in for swelling under the chin or something like that.
So it could be that you wouldn't even know it was there until it got to one of the later stages. Then.
Typically, yeah. Okay. Unfortunately, by the time I usually see them in stage 3 or higher.
Okay.
She was asking if most dogs feel pretty normally and act pretty normally, that they are typically in the higher stages by the time we diagnose them, because most pet owners are not routinely feeling the lymph nodes or anything like that. They may notice some swelling under the chin or swelling somewhere and bring the pet in for that, but usually they feel fine. Substage, that kind of goes with this too, absence of clinical signs of illness. So the majority of dogs are substage A, or if they're feeling sick, vomiting, not eating, lethargic, then they would be substage B. Treatment for lymphoma, the gold standard is multi-drug chemotherapy. By and large, it's called the CHOP protocol. It's a 4-drug protocol. That is, some of them are administered intravenously, some of them are given orally. Typically done through oncologists now. I personally have done a fair amount of chemotherapy myself before oncology became really a big specialty, and I still do it. I'm comfortable doing it with my pets, and as long as the owners are aware that they have the option to go to the oncologist, a lot of them will choose to stay with us. Rescue protocols are typically if they failed the CHOP protocol or they have gone into remission and then come back out of remission, and there's a lot of different ones of those. That I tend to not really get a lot involved with because it's hard for me to get a lot of the drugs. Palliative treatment, if they decide they don't want to go to the chemotherapy route, is typically just prednisone. Makes them feel better, decreases the size of the lymph nodes for a period of time, usually a couple weeks to a couple months, just makes them feel better. There is, I will say, one case where lymphoma is not as big of a deal. They can have what's called indolent lymphoma, typically found in the spleen. And diagnosed typically by aspiration of the spleen. But if they do have that, taking the spleen out can actually be curative. And this was something that one of my dogs had, actually. I had brought her in to test out some ultrasounds and noticed that she had nodules on her spleen. So she was acting totally normally. We took the spleen out, diagnosed as indolent lymphoma. She did great, didn't have any further problems after that, and ended up dying of osteosarcoma, but that was kind of a different story. So prognosis with the multi-drug chemotherapy, remission can be obtained for up to a year. I would say that's pretty common. A lot of them may be closer to maybe 6 to 8 months, but prednisone alone, remission is maybe a couple months, but in my experience, probably closer to 4 weeks. So next we'll go on to osteosarcoma. Primarily in large breed older dogs is what I see it, and I actually see a lot of large breed dogs. We see a lot of Mastiffs, Great Danes, Greater Swiss Mountain Dogs, Rottweilers. So this is a pretty common cancer for me to see in my daily practice. Typically characterized by them being lame or limping on the site, or accompanied by a painful swelling, and this is kind of a common thing. We have a saying that we would say is away from the elbow and towards the knee. So typical sites would be the distal radius, so down kind of by the wrist on the front leg, or way up by the shoulder. Whereas in the back legs, it would be closer to the knee. So the distal femur or the proximal tibia, so those the bones that sit right near the knee. Diagnosis, most common is radiographs. You'll see kind of what we call a lytic and proliferative lesion in the bone. It's essentially the bone is going away, which weakens the area. You can do a fine needle aspirate with a pretty good sized needle. Usually they're sedated for that procedure. Better option would be a true biopsy, actually just taking a little core of it and sending out for pathology. The one thing about the osteosarcoma is it can be difficult to distinguish from fungal disease. They can mimic those very same signs. In Colorado, we don't actually see a lot of fungal disease, but we do have dogs that have traveled from out of state. So if you have a dog that has something like this but has been traveling, that's another consideration for that type of lesion. Treatment for osteosarcoma, the gold standard is amputation of the leg, the affected leg, followed by chemotherapy. Not necessarily always possible in these really giant and large breed dogs. A lot of them already have what we call comorbid conditions where they have arthritis or neurologic issues that makes it much more difficult for them to get around once they're missing a leg. In my dog's case, she was a Doberman, but she was on the smaller side. She was only about 55 pounds. So we were able to amputate her leg and she could get around just fine. But I also just recently diagnosed a 195-pound Mastiff. Probably not as good of an option. Chemotherapy for this particular cancer usually involves just one agent given about every 3 weeks, and that's carboplatin. Palliative care is a little bit different. Mainstay is anti-inflammatories are typically non-steroidal, such as Rimadyl, Metacam, Previcox, and other pain medications like Tramadol or gabapentin, or both. The other options, bisphosphonates is a new drug that's given as an intravenous infusion that has shown really good promise as pain control, can be given every couple weeks. Not something you'll see in general practice, typically more especially oncology. You can also do radiation therapy as a palliative therapy, not necessarily going to cure, and well, not going to cure anything, but decreases pain at the site. The biggest concern that we have if the leg is not amputated is they can actually fracture the leg at the site because the bone is so weak. This is a picture of an x-ray and you can see kind of this big black hole right here. That's where the cancer is, and that area is very easy to fracture because there's nothing supporting the bone anymore. So.
My cat had osteosarcoma.
Cats get it too. It's very much less common, but yeah. They can get it as well.
Think he had it because
because it's not as common. I've seen it, I think, in one cat, and I've been a vet for 8 years. So prognosis for osteosarcoma with amputation and chemotherapy, the average survival time is about 9 to 12 months. With amputation alone, about 4 months. And with palliative therapy, it's usually just a couple months, mainly because they're either so painful or they fracture the bone. And finally, for our last one in dogs is hemangiosarcoma. It can be found in the spleen, liver, skin, or really any vascular organ, also unfortunately including the right atrium of the heart. The most common presentation, again, is an older, larger breed dog. Are we sensing a theme here? I see a lot of large breed dogs with acute collapse and pale mucous membranes. Usually you can lift up their lips and look at their gums and they're white or very, very pale. Due to the large amount of blood vessels in the tumor, pieces can break off and they'll bleed into the abdomen. They can also bleed into their pericardium or the sac that is around the heart if it's on the right atrium. This is a life-threatening problem either way, either bleeding into the abdomen or bleeding into the pericardium. Diagnosis, usually pretty easy, unfortunately, either x-rays or ultrasound. You can generally see the tumor pretty easily. But again, this is one that by the time we realize what's going on, it's either a fairly large-sized tumor or they're bleeding into their abdomen. Abdominocentesis is actually taking a needle and sampling the fluid in the abdomen, which would be blood. And we look at the hematocrit, or the percentage of the blood that is red blood cells. Typically, the hematocrit of the fluid coming out of the abdomen is higher than the hematocrit of the dog, which is a bad thing. Treatment for this one, gold standard is splenectomy or removal of the spleen, followed by chemotherapy. Again, this is more of a single agent chemotherapy given every couple of weeks. This one is adriamycin. If they're in a life-threatening crisis, such as hemoabdomen or they're bleeding into their pericardium, hemoabdomen requires surgery. You can actually use an ultrasound to guide a needle into the pericardium and remove the blood from around the heart. Temporary fix, but we'll sometimes give them some time. That's kind of what I was just talking about here. The problem that we have is once you get a big buildup of fluid, whether it be blood or anything else, it compresses the heart and decreases its ability to beat effectively, which is called cardiac tamponade. So prognosis, unfortunately, this is one of the worst cancers that we typically see. If they have a hemoabdomen without surgery, they typically will die within 24 hours. I have, in some cases where surgery was not possible, used a Chinese herb called Yunnan Bio, which is just given orally. Sometimes it will help control bleeding and give them a little bit more time. Just kind of depends on how much blood they already have in the abdomen and how much blood they've already lost. With splenectomy alone, median survival time, unfortunately, is still only 19 to 86 days. And even with chemotherapy, you're still looking at about 6 months. So this one is not a nice disease. Not that any of them are, but. Anybody have any questions on dogs before we move on to cats? All right. Oh yeah, go ahead.
So I've been through several of these cancers with dogs, all with golden retrievers, little tumor factories. So I had a dog. One of my dogs was. We started out with it was squamous cell carcinoma on one of his toes, and so they actually removed the toe. And then I think it was about a year later, he started limping, and I took him in, and they did an X-ray, and he actually had a big tumor on his pelvis that had broken his pelvis.
Oh wow.
So was that like osteosarcoma probably, and could it have started with that tumor on his toe?
So there's a couple possibilities. The question was, her dog went in and had a squamous cell carcinoma, which is a different type of cancer, on the toe. And they amputated the toe, but then about a year later came up with a tumor in the pelvis that actually fractured the pelvis. It is possible it could have been spread from the squamous cell carcinoma. It is also possible, unfortunately, that it could have been a separate osteosarcoma. Really, the only way to know would have been to biopsy the area and find out what it was. But yeah, I've unfortunately have seen dogs with multiple types of cancer, so it can go either way.
A lot of times, and then it spreads to the lungs, right?
Yes, yep, it does spread to the lungs, which causes pretty big problems. So.
Thank you.
Sure. All right, top 3 cancers in cats, again, in my experience, is also lymphoma, squamous cell carcinoma, and mammary adenocarcinoma. Lymphoma in cats is a little bit different than lymphoma in dogs. They do not typically get multicentric lymphoma or enlargement of the lymph nodes. They tend to get more of an internal form of lymphoma, either gastrointestinal, renal. Mediastinal is a little bit interesting. Most people don't know what the mediastinum is, and that's why I put this up here. It is actually this area that sits kind of between the heart and goes up here by the trachea and the esophagus. There's a lot of lymph tissue in that area and can be an area that can get lymphoma. They can also get nasal lymphoma. Again, it's not really as common. Most cats that have the gastrointestinal form present with gastrointestinal signs, such as weight loss, vomiting, diarrhea, or decreased appetite, or all of the above. Diagnosis, because it's more of an internal thing, abdominal ultrasound is kind of our mainstay, and then biopsies of the area. Biopsies can sometimes be done with ultrasound guidance, or they can be done just by an abdominal exploratory, so an actual surgery to collect biopsies. For mediastinal lymphoma, they will often get fluid in their chest called pleural effusion, and you can actually use a needle to remove some of that fluid and then send it off for analysis, and you'll see the lymphocytes there. Treatment, again, fairly similar to dogs. Prednisolone is very similar to prednisone. Cats actually lack the enzyme that convert prednisone to prednisolone, so we have to use prednisolone in cats as opposed to just prednisone. Chemotherapy for them is an oral form called chlorambucil. It's just a tablet that's given daily to every other day. If there is a solitary mass in the GI tract, it can be removed, but again, likelihood that it's already spread is pretty high. If it is a nasal lymphoma, they can do radiation to the area. So this is the ultrasound of a kidney. Actually, it's kind of this outline here, and then this kind of big areas here indicate the lymphoma. There we go. Prognosis with prednisolone and chemotherapy, the average time of survival for GI lymphoma is 23 to 30 months, so a little bit better than in dogs. The problem that we'll run into sometimes, the signs And also, actually, the ultrasound findings of GI lymphoma are very similar to inflammatory bowel disease. So there's kind of a fine line that you walk between inflammatory bowel disease and between GI lymphoma in cats. And inflammatory bowel disease can convert to lymphoma. Luckily for us, the treatment for both of them is pretty similar. So if people will do an abdominal ultrasound but won't proceed with biopsies or something like that, you're going to do pretty well treating them with prednisolone, regardless of which form it is. Renal lymphoma in cats is, again, a pretty bad disease. It's pretty aggressive. Average survival time 3 to 6 months. Nasal lymphoma, on the other hand, if treated with radiation, has a very good prognosis. So that's just a little kitty. This is actually, Kitty was treated with radiation for nasal lymphoma. Squamous cell carcinoma in cats is also pretty common. Presents as a small scabbed area that will not heal, and over time it gets bigger and bigger. It's pretty commonly on the face or the ear tips, which is why I have this picture here of this kitty. In white cats, it's definitely associated with sun exposure. So we tend to see a lot of it here because we have such a high UV exposure. Can also occur in the mouth. The form that occurs in the mouth is much more aggressive, as well as on the toes. Diagnosis, if there is actually truly a mass of some sort, you can aspirate that to look to see the squamous cells. Usually because it's more of just an inflamed and irritated area, you end up removing it and biopsying it. Treatment is surgical excision. That's going to be your best treatment, and you want to be aggressive with it. Wide margins, they end up with a pretty big scar, but if you're aggressive the first time around, they have a much better chance of survival. Radiation therapy can be used, and also cryotherapy, which is actually freezing the area. Not quite as effective as surgical excision, but another option. The prognosis for squamous cell carcinoma, it's a pretty locally destructive and aggressive type of tumor, so it's very aggressive to that particular area that it's in. But spreading to distant organs or metastasis to the lungs or to other areas occurs not until pretty late in the disease. The surgical excision can be curative if it's in an area where you can take wide margins. Unfortunately, because a lot of the time it's on the face, you don't really have as much of an option with that. Oral squamous cell carcinoma is pretty bad, unfortunately. Regardless of treatment, prognosis is about 2 months. And finally in kitties is mammary adenocarcinoma. Again, dogs can get this as well, and dogs can get squamous cell carcinoma too, as we were just talking about. Mammary adenocarcinoma in cats presents as a mass in the mammary chain. Sometimes it can be ulcerated or irritated or oozing. Unfortunately, about 90% of mammary tumors in cats are malignant, whereas in dogs it's about 50-50. Risk factors in kitties are pretty obviously being female, but males can actually get mammary carcinoma as well. Siamese cats tend to be predisposed, and cats that were spayed later in life. This is a one where an early spay decreases the risk significantly. If they are spayed by 6 months of age, it decreases the risk by 91%. Spayed by 1 year of age decreases the risk by 86%. Past that 1 year mark, there's not really a huge difference. So. Diagnosis can be fine needle aspiration, again, looking at cells, excision and biopsy. This is a pretty aggressive treatment. You don't want to just remove the mass, you actually remove the entire chain. So they would have surgical removal of everything on the side that the cancer is on. Chemotherapy does extend the disease-free interval, just decreases microscopic spread from that area. Prognosis for mammary adenocarcinoma, tumors that are removed when they are less than 0.8 inches have a median survival time of 4.5 years, which is pretty good. If they are greater, unfortunately, it's about 6 months. So this is one, again, where the earlier you catch it, the better off you're gonna be. Aggressive surgery, yields what's called a disease-free interval of about a year in 50% of cats and 2 years in about 32% of cats. And without any treatment, most cats are euthanized due to either the tumor rupturing and becoming infected, and I've seen some pretty bad ones, or spread to the chest. Thank you. Anybody have any questions?
How common are these types of cancers?
Unfortunately, more common than you would think.
Oh, okay.
Yeah.
With indoor cats, is the squamous cell very common?
It will still exist. It is not as common as it would be in outdoor cats because it's a lot of the time sun-related.
Okay.
So it can occur without exposure to sun, but outdoor cats are definitely predisposed.
And is there a certain age where any of them occur typically more than others?
Typically older.
Older?
Yep, older cats.
I have a 16-year-old, so.
Aw.
And that was the one with the osteosarcoma 6 years ago. now.
Wow.
So, but he had it on his dew claw, and they did surgery just
Gotcha.
to the dew claw, and he was fine.
Awesome. Yeah.
He's still kicking.
Anybody else? Erica?
Is there any correlation between like diet or holistic treatments, you know, in conjunction with the medications?
I wouldn't say any necessarily published studies about them at this point, but they're definitely becoming more popular. There is some research on diet, focusing more on a higher protein, higher fat diet and lower carbs. That does seem to have some anti-tumor effects. So we definitely encourage people, and at least in my practice, to do as much research as they can, and then we'll work with some holistic veterinarians with Chinese herbs and some other stuff as well if they're interested. So those are my pups. It was on Christmas, and Gloria was not happy about her reindeer antlers, so Haskell was trying to take them off for her.
So a lot of the treatments the same as in humans?
Chemotherapy-wise, dogs actually tend to tolerate chemotherapy, and cats as well, tend to tolerate chemotherapy a lot better than humans do. Most common side effects are GI, so vomiting and diarrhea, but a lot of times they can be controlled if you pre-treat them with some antiemetics and anti-nausea medications. So they actually tend to do pretty well. They maintain a pretty good quality of life.
That's very cool.
With your cat, did they give him chemo too, or did they just
Question
removed
too.
it?
So as the animals are going through chemo, are they out? Are they awake? Kind of just hanging out, resting?
It depends on the dog and or cat and their personality. The question is when they're receiving chemotherapy, are they awake or are they sedated or anything like that? By and large, they're awake. Typically what we do is place an IV catheter. So it's just a one-time poke, and then they've got it taped on, and then you can do whatever you need to do. So if there are longer infusions, we'll have them in hospital, just kind of hanging out in either in a kennel or up front with us, just resting, and they can move around. There's no problems there because everything's taped in. And some dogs and cats require sedation, but by and large, they're awake for it.
Do they, I had a dog that had osteosarcoma that was like 20 years ago. And at that time, they amputated her leg, and then they put like a sponge with the chemo in it surgically inside. Do they still do that?
I think that's fallen out of favor.
It was experimental.
Yeah.
It was at CSU.
Gotcha. Yeah, and CSU has, I think right now, about 16 different studies for various cancers that they can be enrolled in. So I have one dog with lymphoma right now that's in, I think, actually a diet study, and also a chemotherapy study up there, and then one dog, the big mastiff with osteosarcoma, is in a trial up there as well.
Do you often see smaller dogs with these cancers?
Oh yeah.
Yeah?
Yeah, definitely. I think the large dogs are overrepresented for us because we see so many of them.
Right.
But so, Erica.
Do you have like any success stories or memorable cases that came in that were treated? And
We had one Bernese Mountain Dog that had osteosarcoma that had a leg amputated, and I did chemotherapy on him, and I think he lived 4 or 5 years.
oh my gosh.
Yeah, he did really well. So, and I have quite a few lymphoma cases that were in remission for, 8 to 12 months or so and did really well.
recommend treatment after it comes back? Or?
It can be more difficult, and I think the chemotherapy agents are harder on them the second time around. But some owners choose to do it. And I always tell people too, it's a little different than in humans, whereas if you are doing chemotherapy and their quality of life is terrible and they're not reacting well to it, then we stop.
Yeah.
There's no point in continuing at that point. We're not going to finish out the protocol just to finish the protocol. So.
Is it more purebred dogs versus mutts, or does it matter?
It doesn't really matter, unfortunately. There are certain breeds that are more predisposed to certain cancers than others, which may be actually the topic of a separate talk that we do. But it can affect any of them. Anybody else? So I have one more slide with all my dogs.
Awesome.
I have to throw them in there. So those are my boneheads in the back of my car. This is Carson. He's a Pyrenees Collie mix. This is Haskell. He's a Doberman. And this is Glory, who is also a Doberman. So
How
there.
old are they?
Carson is 9. Haskell's about 7. And Glory is about 6. So they're all rescues. So I don't necessarily know their exact ages, but we've had Carson since 2010, and I think he was probably 2 when we got him. Haskell is a recent acquisition. We got him about a year ago, and Gloria I've had since she was 7 months old. So
Oh, they're so cute.
Yeah.
They're being so good. I can just stay there.
they love riding in the car.
My
It's one of their
little-
favorite
when I have them in
activities.
the back of the car and the lid's open, they're like,
Yeah, I think this was when they had just gotten in and were trying to like organize themselves to
were
where they
trying.
could all sit. Yeah.
They were okay then.
Yep. So I also have 2 cats, Dublin and Shannon, but I didn't have any good pictures of them. So
Got both. They all get along?
the cats actually stay primarily away from the dogs because both of the Dobermans have a bit of a high prey drive and they like to chase them. But so.
That's why we were told we weren't allowed to get a husky. Yeah, because of the cats, yes.
Yeah, I keep them pretty much separate. But so, well, thank you all for coming.
Thank you so
I appreciate it.
much. That was great.